Menieres disease is on page 405. You guys can read through it. It's a couple of paragraphs. It's essentially a disease process that affects hearing and balance. It's episodic, and so they have periods of vertigo and tinnitus. They're not exactly sure why this happens. Acute attacks, antihistamines, anticholinergics, benzodiazepines, anything to kind of calm them down and help them with the vertigo and the nausea and vomiting that's associated with the vertigo. Chronic or just daily would be diuretics, then calcium channel blockers, and a low sodium diet. Probably the biggest issue with having Menieres is that they have to live with the fact that the episodes are very unpredictable. Okay, this is a nice picture of showing you kind of from the outer to inner ear. There are two different types of hearing loss that I want you guys to be aware of. Okay, there's conductive hearing loss, and there's what we call sensorineural hearing loss, and they're very different. Conductive occurs in the outer, let's pick a different color, outer and middle ear. So you can see some of the causes of conducting hearing loss. Too much earwax, a little child stuck a foreign body in there. You have otitis medium, there's a buildup of fluid, otosclerosis. These are examples of conductive hearing loss causes. Okay, so what happens with the conductive hearing loss? It occurs in the outer to middle ear, and it impairs the sound being conducted from the outer to the middle, from the outer to the middle inner ear. The audiogram actually demonstrates better hearing through bone than through air. A lot of times people who have conductive hearing losses actually speak kind of soft because their own voice seems very loud to them. So if we're going to treat a conductive hearing loss, we need to know what is the cause and treat the cause. It's possible that if the hearing loss is greater than like 40 to 50 decibels, a hearing aid might be beneficial. Then we get into what we call the sensorineural hearing loss, and this is where there's an actual impairment in the inner ear. So we're dealing with the inner ear and an issue with cranial nerve number 8. Cranial nerve number 8. These individuals have an inability to understand speech. And so the big thing here, guys, is noise-induced hearing loss. And this is what we're dealing with our young people. And then it is an aging issue. So the two biggest factors are noise, trauma, and aging. And there is some congenital and hereditary factors that can be factored in. The other thing here is ototoxicity from ototoxic drugs. We've talked about a few of these, one being loop diuretics, some being chemotherapy drugs. And so these guys have an inability to hear high-pitched sounds, including consonants, and these sounds become very muffled and difficult to understand. This is just showing when we measure on an audiogram, when we lose decimals, what happens. And so when we were talking, for instance, like 40 to 50 for the conductive, possibly being beneficial for a hearing aid. When we're looking at signs and symptoms of a hearing loss, often the first one is tinnitus, which is ringing in the ear. A lot of times people don't realize that their hearing is being impaired, and they're pressured by others who notice it, that they need to seek help. They don't realize, that they're asking others to speak up when everybody else can hear clearly. They're not responding when they're spoken to or someone's looking at them. They're actually straining to hear. They have learned to read lips and didn't realize it. And they have a sensitivity to an increase in the noise level. And so a lot of times family and friends who get tired of repeating or talking loudly are the ones that notice the hearing loss first and pressure these guys to go and get audiogram. So an audiogram is how we validate hearing loss, and that just checks decimal levels in both ears. I believe we've pretty much been through this. We talked about an audiogram and how it checks decimal levels, and we often see behavioral changes in individuals who have a hearing loss. Okay, so these are the various types of hearing aids, and you can read through regarding these different types of hearing aids in your book on page 409. And so there's different types of hearing aids, and you can see those on 409. These need to be properly fitted by an audiologist or a speech therapist. Each of them have their advantages and disadvantages, and you can look on table 22-13 and read through those. These are just an amplifier. That's all they do. They don't fix the hearing. They just amplify sound. A patient has to be ready to use one of these. They have to be motivated. They have to be optimistic that they're going to be helpful and ready to use them. If they have other sensory issues such as vision, then manipulating a small hearing aid and like changing the battery can be difficult. A hearing aid really should be gradually used. Should gradually be increased in use, first in a familiar home environment to outdoor, and then last in public areas where it's very noisy. They need regular cleaning, weekly battery changes, and to be kept in cool, dry places. Speech reading is just commonly referred to as lip reading, and it can actually be helpful in increasing communication. People can become quite good at it, maybe understanding up to 40 to 50% of what people are saying, especially when coupled with like gestures and facial expressions. The problem is speech reading, many words look alike to a patient. As far as verbal and nonverbal communication techniques, these are described on page 410, and you can read these. They're in table 22-14. Okay, so for someone who has severe to profound sensorineural hearing loss, a cochlear implant is a possibility. So these are for people who have severe to profound hearing loss in one or both ears. The ideal candidate is one who has actually become deaf after they actually learned how to speak. For people who have a conductive or mixed hearing loss, the implants can be beneficial. There's an actual system that's a little bit different that causes direct bone conduction and actually integrates with the skull bone over time. But there's a lot of training and rehabilitation that goes along with these particular types of implants. The benefits of the cochlear implant is that they give the individual who didn't hear anything an improved ability to read lips, monitor the loudness of their own voice. It helps them with a better sense of security and feelings of isolation. It is primarily a hearing device for people with severe to profound hearing losses. And like I said, there is extensive rehabilitation that has to go along with an implant. Okay, a cochlear implant is a surgical procedure. There is a microphone. The microphone is actually on the outside, placed behind the ear, so it's visible, but it's very small. Then there are two pieces that are actually implanted under the skin. It's a speech processor and a transmitter. So you have like a speech processor and a transmitter. And then you have an actual electrode system that is implanted in the cochlea. And what this does is it sends electrical sounds and it stimulates the auditory nerves. And then it can cover a wide range of sound frequencies. We've been through a few of these. There's a lot of assistive devices and techniques that are available now. Different things that amplify sound, for instance, telephone receivers that amplify sounds, telephones that actually will flash when there's a message. It's activated by sound, an infrared system for amplifying sound. There's also texting systems that have voice interpretation on them. Obviously, TVs now has the capability of closed caption, and then there are specially trained dogs that help people with hearing losses.